So this seems to be a little bit of a point of confusion. So I want to talk about TPO and TGA antibodies. There is thyroid peroxidase and there's thyroglobulin. This is going to be a real short video, I promise you that. But hopefully it will clear up some confusion. I just had a patient this week that came back with thyroglobulin antibodies at age 26 and thyroid peroxidase was 0. And he was very confused as to what this meant. Because of course the thyroid on that particular lab, the thyroglobulin went up to 25 and he was a 26 and was flagged with red. Now we went into the functional medicine discussion regarding optimal versus normal. And I explained to him that the reason why we are moving on from that into an ultrasound to confirm the presence of Hashimoto's is because there are the presence of antibodies in that thyroid globulin test. Even though thyroid peroxidase is 0, we don't need both tests to be positive in order for the presence of Hashimoto's to be apparent and to be diagnosable. Now we can absolutely move on to an ultrasound, and the ultrasound is to see if there's actual changes in the thyroid. Of course, we're checking for nodules, we're checking for goiters. If any are abnormal, that will move into a biopsy to rule out cancer. But in general, we're looking for those abnormalities that indicate the destruction of the thyroid from Hashimoto's, from having antibodies, from having an autoimmune condition, Hashimoto's, where those little soldiers go out and start beating up your thyroid. So if you're getting beat up every day, right, you're not going to look the same. That's where the ultrasound comes in. But the bottom line is we want to test TPO and TGA. I've also been seeing this weird pattern with my patients where their physicians, whether current or in the past, will only test one of the two forms of antibodies. We want to test both TPO and TGA. That's how I abbreviate it. Thyroglobulin antibodies, thyroid peroxidase antibodies. So you want to ask for both of those tests to really get that full picture of what your thyroid is doing. And it's also worth mentioning, if you have Graves' disease, please still ask for TPO and TGA, because you can have Graves and Hashimoto's at the same time. You will most likely swing back and forth, but there can be the presence of Hashimoto antibodies even in the presence of Graves' disease antibodies. So please ask for TPO and TGA. Make sure both of them are on your test form. Make sure you have been tested for both of them. And then we will look at them from an optimal point of view. So for additional information, I'm going to put my lab and symptom checklist link in the description. So you can click on that. You can download that. That will tell you all of the labs that you need to get, what they mean, and where you should be optimally. So even though the patient that I talked about had a 26, even if he came in at a 20, I would still say, hey, you know what? Those are 20 soldiers. You have the presence of antibodies that will eventually move into full-blown Hashimoto's with severe hypothyroid symptoms, just like we talked about before in past videos. You can go back and look, but we talked about the 5 stages of Hashimoto's. So remember, the presence of antibodies is in stage 2, where your thyroid numbers can still look really pretty, but you still are suffering from symptoms. So the question is, are we going to wait until you're 40 pounds overweight and can't get out of bed to treat it? Or are we going to pay attention to those antibodies? In order to pay attention to the antibodies, you need both tests. So get the TPO and the TGA, and then download that lab and symptom checklist so that you have optimal ranges right in front of you to compare all of your labs. If you have any questions, let me know. Please share this video with others because it definitely helps out. I promise you that. Take care.